Greetings, this is Dr. Bill White again, and I want to talk to you this morning about something that's been on my mind for years, and that's why we're not doing adult orthodontics. It is ridiculous. We tell people you can't do it, and you can. I mean, you can straighten people's teeth as long as they're living. And I had people write me back from various places over the world, and this young man said he was 25 years old and he wanted to move a 6-year molar up and fill up a bicuspid spot. And the guy told him, well, your bone's set and you can't do it. I mean, you can't do this. And it's so wrong that this is ridiculous. And I want to show you some adult cases. I'm not going to carry this one to where we take him out of the braces, but I'll show you right up to it and what we did. And there's a world of this orthodontics out there, and it is going neglected. I mean, people talk about not having enough work. There'd be so much orthodontics out there that we don't have enough people to even begin straightening their teeth, and people that want it done. So let's take a look at this case and just go through this and show it to you. Now I've got a little problem here. I'll have to get my button going again. Let me get, all right, now see if we, all right. Here's a real nice guy. I mean, I've known him for quite a while. Now, I'm not going to carry it all the way to the end, but look at this guy. He can afford it, he wants it, and he's got a problem here, and there's so many people go around with problems like this. Now this is in the work, we had already started it, but I'm going to go through the models and show you what's really wrong. I mean, this gentleman has a closed bite. I mean, his lower teeth come up to here somewhere, and he's wearing the backs of his upper teeth off and the front of the lower teeth, and the jaw wants to come out, and he's subconsciously trying to do that for years. When you have a closed bite, you cannot chew properly. You just chew straight up and down, and that's not normal for human beings. You want to be able to chew from side to side, and I'll show you why you can't do that when you've got a bite like he has. I want to call him by name, but I don't want to use his name here, but let's show it. He's got a tooth here that's completely, the cuspid is completely crowded out on the side over there. Now let's go and looking down on the lower anterior teeth now. You see these teeth are worn off right in here where they go right up against the gum tissue on the inside. Now I'll show you a picture in just a second here. Here are the upper anteriors. Now the lower, he bites the edge of these, and he's worn, see how the tooth is worn down in here. And his lower teeth come right up to the gum line in there, where we can show it to you from different angles since we're using models here. You can see the depth of the bite, and the lower jaw is locked in. He can't come out where it wants to. So this crowds the condyles back into this retrodiscal tissue. Now many of these people don't have any joint problems, but then a lot of people do. The joint wants some freedom back there. You put too much pressure on it, and so you see the lower teeth actually should be out in front of this, and you can't move your lower jaw because of the way the teeth are being in contact over here. And this is on so many adult people, and I don't care if this guy is 60, 70, if he wanted this when he's 80, you could do it, or 90, I guess. I haven't done anybody that late, but we've worked on people up in their 80s, and when one of them would go into 90, but never started them at 90. All right, here, let's go to another picture, and you're looking down on the teeth. You can't even see the lower teeth on this. Same thing over here, because this bicuspid crowded out. It's so crowded. These teeth on the bottom down here are further forward than they should be, unless you had this open. Now, if we raise these teeth up, so we've got the mechanics that will pick these teeth up. If these were up here, you could put them down too. We can do just darn near anything you want to do within reason on moving the teeth, and the age doesn't stop it from being done. And the bone doesn't set and everything else, all this ridiculous things that we've come up with excuses so we don't do these things. And that's not really what we should do. All right, here it is. When he bites down his lower teeth, actually, if he pressed them together, they come up and touch the tissue from the inside. And and this one right here had the whole front worn off of it, and you got a kind of a mess here. And he subconsciously does not like for his jaw to be there, so he rubs it and he wears them out like that. So I'm getting old myself and I get choked up, but you can see those teeth go up in there, and he really wants to bring his jaw forward. So we have the mechanics and what to do and how to do it, and you can move those teeth on any body as long as they have some bone up there that the teeth are in, they come in. And this is it. He has a cross bite, a deep bite, and he's worn the teeth down. Now here's a close-up of the upper teeth. You see how he's worn the back side of these teeth off, even up in here, there, enamel through there. Here, this is worn slick, right in this area. And he's been that way all for years. And this has bugged the heck out of him. So he wanted to get his teeth straightened out. And we can do that, and orthodontists can do that. And they ought to be taught how to do this in schools or wherever. And so that's been something that bothered me for years. I mean, we act like we can't do this for these people, There's more orthodontics out there than we've got people that can do this. There's more work than they can do. And that's what bothers me. And we charge, we don't want to do this, we charge a certain price for orthodontics. This is ridiculous too. We should charge what needs to be charged, even if it's $15,000, $20,000 for a case. I mean, the people that would be happy to pay to get rid of this problem like this. See, this guy is chewing into this tissue right up here on the upper. That's keeping it sore and irritated. All right, we're going. Here it is. We're in the middle of it now. We put an intruding arch in here that was way up like this. We pulled it down and we picked these teeth up. As we took them up, they started flaring out. So we put this little little wire in between here, which won't let them flare out like this. If you got them here and you go up, they'll flare out. It come down like that. It's holding them in place. As we got up there, we shortened it. We shortened the arch wire right here. And we do the same thing on the other side. And we lined all these teeth up down here and leveled them out. It's just regular orthodontics done to people that you would think somebody come along and tell me that you can't move this, and I tell them you're crazy. You can move those teeth, you can put them where they ought to be and relieve this guy of this problem. And here it is, the other side. He had the cuspid crowded out and all sorts of mess. I don't think we took any teeth out at all on him. This is just showing you where we went. Now there's where those bottom teeth used to go and wear those teeth off. Now look at the teeth like that. And we can put them in a retainer with a bite plate on it, and I can keep that position on those teeth the rest of that guy's life. And they're lined up like that. And the bone goes with them as you move the teeth around. As I intruded those teeth, they didn't bury up in the gum. The teeth, as they went up kind of gradually, the bone structure around the teeth goes right up with them. And you'd think someone would think they'd bury their teeth. You don't do that. And that's not in good focus there, but it shows you the lower anterior teeth up here where it really wore the front of that tooth off. And so he can have the filling put in that if he wants to. Now here's the rigging. You can do the orthodontics. There's no mystery to what it can be done. And I've shown you, you can go back there, videos on a guy that went off and never came back for 6 months. He had a deep bite. He came back because he couldn't bite through a sandwich. Had his teeth opened completely up there on 2 little light wires in there. So to keep them from flaring, we put this little bitty wire in here that held them together as we intruded the teeth. Now the guy can chew like this. He could go from side to side. And this is about as far as I need to carry this case. And I just want to tell people, I would like to get into schools and they should teach people how to do this adult orthodontics. If it takes more time and more effort, charge more for it. But don't tell the people it can't be done. It can be done. And I don't know how far this video will go around the world and how many people will be interested in looking at it, but I hope to goodness someday we change the way we teach orthodontics and we change the way we charge for it, and to charge whatever the job requires. We've got all kind of adult stuff here, and I'm trying to promote that. And so let me see if we show he was off to the side, so we pulled over this way. Here is this intruding wire that we put in there. See this circle back in here, and this wire came off. I was coming around this way, and we ran it up here. As we pull this down, it tightened that up, and it picked those teeth up. And it'll do it on anybody. And I don't care unless you've got an ankylosed tooth in there, which you can break loose surgically. And I've never found a tooth you couldn't move and use this on. And I've been doing it for, I don't know, something like 60 some odd years. And you can do this. And so I want orthodontics to change all over the world. There's no sense in us not doing the things that people want to have done. Now that wire right here, you see how it was going up this way. We pulled it down, tied it to these two, and it'll pick up. And you can put this on there day one. It doesn't have to be a rigid wire underneath here. You can put it on with just a little flexible wire right there. So I'm going to go and see. And that's what actually leveled this bite out and allows this man now, his jaw came forward, and now he can chew like a normal person could. There's another view of that. And this is where we ended up with this young man. And I'm going to sign out now. And thank you for watching. And I hope to goodness somebody looks at this that has some authority in the schools around over the world that are teaching people orthodontics, especially in the United States. Now there's a lot of good orthodontists that are doing some adult orthodontics, but it is not a general thing. In one school that I know about, they said they don't want to teach adults. So I'm going to sign off, but I appreciate all of you watching this, and whether you're an orthodontist or you're a dentist that's doing orthodontics, or you're just an individual that your teeth are chewing the roof of your mouth and you want something done, take them this video and show it to them. We've got a lot of others like that. So I want to say goodbye and get out of here. Thank you very much. Yeah.